I am going to tell you about what my vision is about Good Samaritan Hospital, the Center for Breast Health, and the way that I take care of patients. So, breast cancer is a very scary thing. Everybody knows somebody who has it. Every woman is afraid of getting it. And so it's a very complex disease. And it's not just about surgery or equipment, it's really a big deal. And it's hard to take on all those layers and to give the right, I think, to give the right kind of care. Now, what do you need? You need the right equipment. And we have now, at Good Samaritan, we have digital mammography. And digital mammography is crucial, okay? Because mammography is the reason that the death rate from breast cancer has gone down in the last 10 to 15 years. Because we've been detecting breast cancers earlier and earlier. And the earlier we detect them, the more curable they are. Now, one of the problems with what was older mammography, analog mammogram, is that women who were younger, women who had dense breasts, mammography wasn't really that helpful. You couldn't really see anything. So digital mammography allows us to pick up cancers, smaller things, in all women. So it's clearly the best tool, and we have it. And the other piece is breast MRI, which we're getting within a month or two, because you need to have breast MRI to screen high-risk patients. You need it to patients who have breast cancer. You need it for a lot of reasons, and we're going to have that. And you can have all the equipment that you need, which we have. You need all the cutting-edge stuff. Because one of the things that is interesting about breast disease is that the technology is constantly evolving, and you always have to stay on top of it. But technology all by itself is interesting, but it's not enough. Even though it sounds very sexy, you know, to say, oh, we have the cutting-edge technology, and we have, you know, we can do image-guided biopsies so you don't have to have unnecessary surgery and all that stuff. That's all wonderful. But if you don't have, in my opinion, the right feeling, the right care, the right approach to the patients, it's not going to work. So why do people go into medicine? Well, hopefully, most people go into medicine because they want to take care of people. They want to help people. And I really believe that most people who go into medicine, that's what they do. But in this world, in the real world of shrinking reimbursements, terrible medical malpractice, no resources, a lot of times the focus of the patient has gotten lost among all of those other things. Now, doctors are just human. So we have to worry about paying our bills, paying off our student loans. We have to think about all of those things. But I don't think you can ever forget that the focus is about the patient. And when I came up here to Bon Secours and I was interviewing at Good Sam, I said, look, all I care about is my patients. Everything else is secondary. So whatever we do, we have to talk about how it's going to help our patients, which is why I said digital mammography, got to get it. MRI, got to get it. Okay? This was all crucial in order for me to take the best care of my patients. The funny thing is that the girls in the office that I'm in right now, they've been working with 2 surgeons, both males. And so when my patients come in, they all run up to me and give me a big hug, which for me is normal. And they're all like looking at each other going, what is happening here? This is really weird. It's very easy to, especially with all of the outside influences that I mentioned, of subspecialization and malpractice issues and whatever, it's very easy to focus on the patient as a disease process, as one part of them. But I'm old-fashioned. I believe that a physician should truly be a healer. And so I'm not just interested in the fact that you have an abnormal mammogram. I'm interested in how many kids do you have? What is your family like? You know, what did you do over the weekend? So that there are times when I will talk to my patients not just about their mammogram or whatever, but whatever they need to talk about. And so, no, do I have a couch and am I taking notes? No. But I think that it's crucial for me to get to know my patients that way in order to take care of them. And so I do. So my patients all have my cell phone number, all of them. And I started doing that 15 years ago, and some of my colleagues were like, you are absolutely out of your mind. you give out your cell phone number to everybody, you're never gonna have a moment of peace. And the thing is, it's not true. Women call me, or their families call me, when they're scared, when they need help, when they have a question, when there's something that I didn't explain well, or when they just need somebody to give them a little pep talk. And you know what? It's fine. My phone's on vibrate. It's at my bedside. It doesn't wake my husband. It wakes me. I mean, it's been there for 15 years. And it makes an incredible difference to patients to know that they're not alone. That at any moment, in any time during the day, that they can pick up the phone and call me, not get my service, get me directly, and I will do whatever I can do over the phone to ease their anxiety. Because the thing about breast cancer and the thing about breast disease is the level of anxiety is unparalleled. It's like nothing else, okay? The New York Times did this very interesting survey a few years ago where they asked 100 women on the street what the #1 cause of death was in women, and a significant number said breast cancer, when it's heart disease and stroke by 30 times. But that just tells you where people's heads are, and that just tells you how anxious women are. So what I'm trying to do, with the help of a lot of really supportive people in administration, and is build a place that can give the best quality treatment, the best clinical doctors, the best radiology techniques, the best everything, but also try and nurture these patients through this incredibly difficult process while being sensitive to all these other issues. So what does that mean? Well, that means that when you come in the door, the Center for Breast Health, you're not going to be attacked by a lot of loud music. You're not going to be, you know, everything is very soothing. The Center for Breast Health will be built out hopefully in the next 3 or 4 months. And I've already picked out all the colors and things like that, and it's not pink. I think we've had enough of pink. You know, it's going to, you know, but it's all very warm tones. And little things make a big difference, okay? So things like eye contact. Things like what kind of magazines are in the waiting room. Because when women come in and they're very conscious of their own vulnerability at that moment, the last thing they want to do is pick up a magazine of Cosmopolitan showing some woman with a plunging neckline. Okay, so there's none of that. Okay, the pictures around, there'll be no pictures of people. They're all soothing, impressionistic paintings. Because again, a woman doesn't want to sit there and look up and see a family or a woman or anything that's going to, again, remind her of her own reason for being there. I'm trying to make this as easy as possible. We have now full-length, very comfortable spa-like robes, which say the Center for Breast Health on them. Because when you go to the doctor for a breast exam, and you know, you're sitting there in the room, and you're wearing that half little thing, and somebody opens the door, and then, you know, it's like you feel very dehumanized. And it makes a big difference to be sitting there in a nice warm robe that covers you from head to toe, so that you know that when your doctor, when I walk in the room, you're not going to feel that dehumanization. You're not going to feel like, wow, I've just flashed another person. You're going to feel comfortable. And the most important thing is what happens when I'm sitting in my office across a desk or next to a patient, and I have to tell them that you have breast cancer. And it never gets any easier. Never. I'm doing it for 16 years. And sometimes I still cry when I tell my patients, especially the very young women who have children. And I am there for them. Now, part of my team is a patient navigator. And a patient navigator, for those of you who don't know, she's kind of like my right-hand person. She's my social worker / outreach person. So when I tell somebody they have breast cancer, we're there to catch her together. So that whatever that person needs in terms of support, in terms of they need to find a babysitter while they go for their treatment, they don't have anybody to drive them home from their surgery, she's there. And I'm going to ask Anna to stand up. And the thing is that I've only been at Bon Secours for a short period of time, and I've only worked with Anna for a short period of time, and I feel like I've known her forever. Her job, and I use that word, is really for me to help the patients through this process. And it doesn't necessarily also have to be about breast cancer. So, for example, when I was in Queens, I had a patient navigator there. There were times when I had patients who came to me and they told me about domestic abuse. And that's part of my job, in my opinion, as a healer. I'm not going to say, well, your breasts are fine. I'm really sorry that your husband's beating the crap out of you, but your breasts are fine. So I would bring my patient navigator down, and we would call the hotline, and we would do what we had to do.